All right, so in this video, I'm going to cover the basics of flipping gloves. Now, the reason we want to flip our gloves onto our Mayo stand, rather than simply putting them there or opening them up and putting them there, is because in the packet, they are currently sterile. And we want them to remain completely sterile as we bring them onto our Mayo stand, where we're going to have our sterile field open. So we want to get them from the packet onto our sterile field completely sterilely, which means they don't want to touch anything that is not sterile. That would mean our hands, that would mean the outside of this wrapper, or anything like that. So that's why we're going to flip our gloves onto the sterile field. Now, the first part of setting up our Mayo stand is making sure it's the right height. We don't want it too high or too low. We want it to be at about waist level. Now, for me, my waist is about here, so I've got to bring the Mayo stand up a few inches, and by doing so, that's going to allow me to have good aim when I flip the gloves onto my sterile field. So to do this, I'm just going to take the Mayo stand, and I'm going to raise it up just a few inches to about there, and that's a nice height for me, all right? So the next thing we do is we're going to create our sterile field, and that means opening our gown. Now, position the gown just about at the edge, maybe a half an inch away from the edge. That's where I like to put it. People use different methods, all right? So I'm going to open the tab, pull the tab forward, and then pull it away. I'm going to find the next tab. Now, my next tab is over here, so I'm going to pull that way. So what I'm going to do is I'm going to use this hand. I'm going to hold this tab where it is. I'm going to pull this tab away from me this way. All right? This, by doing so using two hands, you're keeping the other tab that you just opened from flipping up. And that tends to happen with newly wrapped gloves or newly wrapped gowns. So I'm going to continue to hold this one. I'm going to come in this way, grab this tab, pull it this way, pulling it down over the edge, nice and tight. And then holding onto this one, I'm going to reach in here, grab this one, and pull back, and then straighten up those corners like that. So by doing so, I've now created a sterile field. Most of what you see here is now sterile. Now let's go over the boundaries of what is sterile and what is not. Everything right up to the edge where the drape falls over the edge, this side is sterile. Anything down over the edge is not sterile. Now in the back, things get a little interesting. What you have in the back is anything about an inch from the silver part of the Mayo stand, about an inch from the edge of the drape, is considered not sterile. And that's because the silver part, the metal part of the Mayo stand, is not sterile. So we're giving ourselves a little bit of a safety margin right at the edge of that drape to make sure that no little contaminations have happened in that area. So anything within an inch of the silver is considered not sterile, but everything else on the horizontal surface is considered sterile. So with your sterile field created, it's now time to open your gloves. Break the seal at the top and pull apart. Now when we go to flip our gloves, one of the things that we want to do is we do not want any part of the wrapper or our hands to go over our sterile field. You can never have anything that is not sterile over a sterile field. Why is that? Well, because what is dust? Well, dust is little skin cells and things like that that sort of fall off and flake off of our skin all the time. So even though your hand may be clean, there's still a little bit of bacteria on those skin cells, and those skin cells are sloughing off all the time. So as soon as I put my hand over a sterile field, a non-sterile hand over a sterile field, look, there goes a little skin cell. Oh, there goes another little skin cell. Okay, so as those skin cells fall off of my hand, they're bringing bacteria with it. That means our sterile field is now contaminated and we can't use it. So at no point can any part of my hands or can any part of the wrapper, because the wrapper, the outside of the wrapper is not sterile, none of this can go over our sterile field. So we need to get our gloves, which are still sterile, from our wrapper onto our sterile field without going over the sterile field in any way. And we're going to do that by flipping the gloves through the air so that they don't touch anything. They don't touch the edge of the wrapper. They don't touch our hands or anything else. They fly through the air and onto, hopefully, the center of our sterile field. Now, there's two methods that you're going to see to do this. There's two primary methods. One is the vertical method, and I'll show you that here. The vertical method means turning the wrapper this way, taking our hand, hiding it sort of behind the wrapper here, and going up and onto the sterile field. Now, the gloves have now landed there. They haven't touched anything that wasn't sterile. That's a good thing. But here's the problem that I kind of have with this method. A lot of people swear by this method. You're going to see this a lot of places. I personally don't like this method for a minor reason. And notice this. When my hand goes like this, it is now somewhat over the sterile field. In fact, if you can technically do it from here, but that means you got to throw it a little bit. So what usually happens, it's easy to get lazy and the hand will go over the sterile field. Now, another argument is, notice how the wrapper is sort of protecting my hand so that the hand itself, the argument is not over the sterile field because the wrapper is sort of shielding it, and anything that would be falling from my hand would land on the wrapper and not on the sterile field. So look at it this way. Is my entire hand and arm completely covered by the sterile wrapper? I don't think so. So when I go over that sterile field, even just a little bit, there's the chance that something could fall onto this sterile field and potentially contaminate it. That's why I prefer not using the vertical method. So the horizontal method, as you can probably guess, means holding the packet horizontally as you flip the gloves onto the field, and it looks something like this. There you go. That was a nice landing. And notice the packet did not go over the sterile field. Nowhere did my hands go over the sterile field. Nowhere did the packet itself go over the sterile field. The gloves flew off of the packet and landed onto the sterile field without touching anything, which means they're not contaminated. So that is the horizontal method. That's the method that we're going to be going over today. So flipping gloves is probably one of the most challenging things you're going to learn in lab. And getting the technique down, there's lots of little steps involved in doing this precisely so that no contamination happens as the gloves go from the packet onto the sterile field. So I'm going to show you some of the basics of that here, and then we'll go into the details of all the little tips and techniques a little bit later. So as you're opening the gloves, you don't want any part of your hand to be over the gloves because, again, non-sterile cannot be over sterile. So you want to make sure you tilt your hands away and protect them as you open the glove packet. And your hand should stay this way away from the gloves themselves so they don't contaminate. Now with the gloves open, it's time to flip them. And to show you the technique, I'm going to do it without the gloves and the packet. I'm just going to go through the motions so that you can see my hand positions. So first thing I'm going to do is take my elbows and I'm going to bring them all the way in to my abdomen. So my upper arms are straight down, my elbows pressing into my abdomen. And by doing so, notice the palm of my hands. The palm of my hands are now pointed towards the ceiling. That's where you want them. You want the palm of your hands pointed up, and then you're going to take your fingers and curl them under. So you're like this. This is the position, and then the gloves will be resting on the ends of your fingers. Then during the flip, you're going to flip your fingers over, you're going to bend your wrists a little bit, and you're going to arc your arms slightly, and we'll get into the details of exactly what that looks like in a later video. So this is the motion, holding your hands with the palms up, flipping the fingers and the wrist, sort of in a Spider-Man effect. You know, you're bending your wrist a little bit, so your fingers and wrists are bending over, and that's what's going to flip the gloves onto the field. All right, so now with the gloves and the wrapper, I'm going to take my elbows all the way into my abdomen. That turns the palm of my hands upward, and then using my fingers and my wrists, I'm going to flip the gloves onto the sterile field. Now notice as I'm doing this, I'm taking the wrapper right now, perfectly horizontal. It is pointing, I'm going to say pointing straight upward, all right? So with the wrapper like this, it is pointing straight upward. I want to take it and bend it over, so now it's pointing horizontally, it's pointing that way. And I'm going to bend it a little bit past that. So I'm actually pointing down at the sterile field. I'm pointing at the spot that I want the gloves to land on. So again, with the gloves in the packet, watch the process again. I'm going to elbows in, palms up, and flip all the way over, pointing downward at the spot that I want the gloves to land. Again, no point did the wrapper or my hands go over the sterile field. So in my opinion, the most important element of flipping gloves is making sure that the wrapper doesn't stay in a horizontal position and you don't do something like that. All right, when you do that, it's kind of hard to aim where the gloves are going to land. We call that a flop rather than a flip. So we really want to make sure that the wrapper itself flips over so that it is pointing at the sterile field, like that. Now, practicing that step from 2 feet away takes a lot of work. It takes a lot of practice to get it to do exactly what you want. So here's my recommendation. Remember that whole part about not going over the sterile field? We're going to practice by going over the sterile field. It's just for now, it's just for practice. So what I want you to do for the next day or so is practice with your gloves. I want you to start by putting those gloves onto the sterile field. We're going to do it right here. I want you to get used to flipping that packet all the way over and putting the gloves exactly where you want them to land. So if you want them to land there on your gown, you're going to take them and put them right there. Now, I understand that we're contaminating right now. That's okay because this is just practice. What I want you to do is get used to flipping the packet all the way over so that you're putting the gloves where they want to go. All right? Now, practice again. After you do that several times, I want you to then move back an inch or so, still over the sterile field, but move back a little bit and get used to, again, putting the gloves where you want them to go. Practice it again. Put the gloves there. Flipping that packet all the way over, making sure that it is not just, like that. See what can happen. So put the gloves onto the sterile field. Then, after you've done that several times and you've gotten good at getting them to land exactly where you want them to land, I want you to step back another just a few inches and do it again, a little bit further. Put, and then again and again, until you get back to where you're supposed to be, which is about, your feet are about 2 feet or so away from the Mayo stand, and your arms about a foot away. And then you're going to be able to give it a little bit of an oomph, a little bit of a toss to get them to land onto the sterile field. So keep practicing this method of flipping the gloves over and having them land on the sterile field over and over until you feel fairly comfortable with that. Give it another couple of days of practicing this method. Then come back, watch the second video where we go into the details of this entire method and work on fine-tuning those techniques. Because as you practice this, you're going to find that there's going to be a lot of little glitches in your technique. In the next video, we're going to work out those glitches. We're going to fine-tune your technique to make it nice and smooth, and you have a completely sterile flip of those gloves.